Efforts to contain the spread of Ebola in the Democratic Republic of the Congo have once again hit a major crisis. According to health authorities, medical and disease control workers have come under attack in an area where Ebola cases have been reported. This time, the incident occurred while the body of an Ebola victim was being safely buried, when grieving family members and local residents assaulted the medical team. The scene descended into chaos within moments, and the response workers were forced to abandon their work and evacuate. An even more serious problem is that, in the midst of this, 11 Ebola patients who had been in an isolation facility left the site. Their exact whereabouts remain unknown, and health authorities are deeply concerned about the possibility of further transmission within the community. Because Ebola spreads through the bodily fluids of infected individuals, the movement of these patients without proper care could trigger a new wave of infections. The clash is reportedly rooted in local traditional funeral customs. In some parts of the DRC, family members and relatives directly touch the body of the deceased to bid their final farewell. The problem is that the Ebola virus can remain present in the body even after death. In fact, experts warn that the bodies of those who died from Ebola can be highly contagious. For this reason, disease control authorities have applied special burial procedures to bodies suspected of infection and have restricted direct contact by family members. And it was this restriction that prompted residents to attack the medical team. Some residents are said to have reopened already sealed coffins and come into contact with the bodies. What makes the situation even more tragic is that containment efforts had recently been showing gradual signs of progress. The number of patients recovering after treatment had been rising, and the combined total of suspected and confirmed cases had fallen from the more than 1,000 seen in the past to around 400. International health organizations and on-the-ground medical teams had assessed that the outbreak was slowly coming back within a controllable range. Now, however, this incident has raised the possibility that those hard-won gains could once again be undone. Health authorities are currently tracking the whereabouts of the patients, who fled while conducting epidemiological investigations to determine whether further infections have occurred. They are also stepping up public education on the dangers of Ebola and on safe burial procedures. Still, with deep distrust of medical workers and strong traditional customs persisting, disease control efforts remain far from easy. On the ground, fears are growing that this incident could lead to a new cluster of infections, and the international community is closely watching the situation. If further updates come in, we will produce another video and upload it. That concludes this report. Thank you.